Hello, everyone. Welcome to the ADHD seminar series. This is a project that is being rolled out by the Berkshire Neuropsychology Service, and this is to an attempt to increase the accessibility of some of our psychological and psychoeducational support for our clients. So it might be that you have received a diagnosis with our service and you're looking for some further support, psychoeducational support and understanding. You might be awaiting a diagnosis and currently on our wait list, and you just want a bit more information about ADHD. That's fine. Whatever the circumstances are, I hope you find the seminar really, really helpful. So if we dive right in. As to what we're going to cover in the seminar today, this is going to be very much a whistle-stop tour of ADHD, and in the episodes that follow, we will go into a little bit more detail about the specific subtypes of ADHD and strategies and support that we can give you psychologically to help you address some of your challenges. But for now, this will be very much a whistle-stop tour of ADHD. We're going to be covering what it means to have this diagnosis. Talking about some of the symptoms of ADHD, the strengths as well as the challenges of having ADHD. I'll be talking about comorbid mental health conditions. That just means any mental health problems that co-occur and exist alongside ADHD. We're looking into the causes of this condition, a little bit about the physical brain, looking into neurotransmitters and pathways. Be talking briefly about neurodiversity and other neurodevelopmental conditions as well. And then finally, we'll end with treatment, information about medication and the psychological support that's available to you if you have this diagnosis. So as you probably know already, ADHD stands for Attention Deficit Hyperactivity Disorder. So this is a neurodevelopmental condition, and it affects how your brain functions and develops across time. This is essentially something that you are born with, ADHD. So there are 3 subtypes that we know of at the moment. We've got inattentive ADHD, hyperactive impulsive ADHD, and then a combined subtype, which means that you have symptoms of both inattention, hyperactivity. And as I say, we'll go into more detail into what each of these diagnoses mean in further seminars. Currently, around 2.5% of the UK population have ADHD. Globally, rates are about 5% on average. Varies considerably between countries. But ultimately, the level of diagnosis is going up, and that's as we understand more about neurodiversity and a lot more about ADHD. ADHD is associated with functional impairment. So what that means is it can have a drastic impact on your ability to function day to day in various domains. So that might be education and work can be really, really impacted by ADHD. It's worth mentioning, if you are diagnosed by our service, we can provide you with documentation that you can provide to your employer, your education provider, that outlines some of the difficulties that you might experience with your ADHD, as well as your strengths, so we can accommodate for those. But ultimately, giving your education provider, your employer, reasonable adjustments that they can make to make your life easier at work or in education. So ADHD can also affect relationships quite drastically. So that might be family life, it might be romantic relationships and friendships. It can affect life skills, so that would be your day-to-day functioning and things like managing home life, paying bills, managing money and finances, doing chores, all sorts of things like that. ADHD can massively impact self-esteem. This particularly applies when ADHD goes undiagnosed for a very long time. A lot of people who come to our service, obviously as adults, many of them haven't received diagnoses as children, and that means that they've kind of gone their whole lives not really understanding what the problems are and not having an explanation for their challenges. So self-esteem can be really impacted, and it can be really relieving to receive a diagnosis and to have an explanation for the difficulties they've experienced. Risk is another factor. So risk-taking behaviours are very common in people, particularly with kind of hyperactive, impulsive tendencies. So examples of this might be reckless driving, substance misuse, which is very common, unhealthy eating behaviours, risky sexual behaviours, poor financial decision-making, and on the more extreme end of self-harm, suicide, accidental death, and then death by misadventure. And then finally, we will go on to talk about this in a couple of slides, but mental health can be significantly impacted by ADHD. So in order to be diagnosed with ADHD, you need very clear evidence that symptoms were present before the age of 12. So not only that, but you also need evidence that there is significant functional impairment. This has got to affect your life quite drastically. And there needs to be quite a number of symptoms present as well. So we'll go on to talk about these in the next slide. So I've broken this down into inattention and then hyperactivity, impulsivity. So with inattention, you're talking predominantly about difficulties with concentration and organisation. So if you have inattentive ADHD, you are likely to have a short attention span, not be able to pay attention for very long on tasks and activities. That particularly applies where tasks are very time consuming, very tedious, or any that require a lot of mental effort. If you have ADHD, you're likely to be highly distractible and easily distracted. So that could be internal or external stimuli. So an example of internal stimuli might be thoughts that go around and around in your head. They can really easily distract you from the task at hand. External stimuli, you're talking about anything going on in the immediate environment and being very distracted by that. You might experience carelessness, so that would be making careless mistakes in your work, for example, a lack of attention to detail. It's very common for people to be forgetful when they have ADHD and to lose and misplace items that they need. You may experience difficulty listening, following instructions, particularly when there are multiple instructions at one time. It can be really difficult to follow in sequence. You can have difficulty organising, prioritising tasks. Frequent task switching is common as well. So that would be you might sit down to do a task for 5 minutes, lose concentration, move on to another task, and continue that pattern, and then fail to kind of return to the original thing that you were doing. And then finally, you might experience issues with time management. On the hyperactive, impulsive side of ADHD, you may experience a lot of difficulty with sitting still for prolonged periods of time. That could be really hard, and that especially applies when you're in a calm, very quiet or unstimulating environment. You may experience difficulties engaging in leisure activities quietly. You may experience internal restlessness. So a lot of people describe this as being driven by a motor, so feeling constantly on the go and feeling a need to do something all the time. You may be very fidgety and move very excessively. You might talk very much, talk too much. You might interrupt other people. You might experience quite a bit of impatience, difficulty waiting your turn, and you might intrude on others' activities as well. And then finally, you may act on impulse as well, so doing things without thinking. The reality is, a lot of people without ADHD might experience some of these symptoms from time to time, and that is relatively normal. It's completely normal for people to experience some of these on occasion. What's really important in ADHD is that there is quite a significant number present, and they need to be, as we said in the previous slide, they need to be impacting on functioning quite significantly, and obviously present since childhood in order for you to be diagnosed. So talking about the strengths of ADHD, it's likely if you have this diagnosis that you have a lot of personality strengths. So very common ones, you're very likable, have lots of energy, you can be very energetic, very spontaneous, adventurous, very fun to be around. You might be very conversational. People with ADHD are often highly intelligent as well. They can be very imaginative, very creative, very good problem solvers as well, think very abstractly and quite often in ways that other people don't think. You can see things that other people don't see, and that can be an immense strength in a lot of ways. Hyperfixation, so this refers to, this is the ability of people with ADHD to hyperfocus. So it's a bit misleading, really, the name ADHD, because there is obviously a deficit of attention. But if someone with ADHD experiences intense pleasure and interest and finds something stimulating, then they can spend hours and hours and hours doing that task or activity and channel all their energy into it. So that in some ways can have a lot of strengths. If you think about a work project or something like that, that you get really, really engaged, really interested with, put loads of hours into your time into that, can come out with really, really great results. People with ADHD are often very empathic, very compassionate in general, but also of other people who are neurodiverse. You can have a really great sense of humor if you have ADHD. You're often very resilient. So you can experience a lot of ups and downs in mood, which is a normal part of this condition, but you can quite often bounce back from those mood swings quite quickly and generally be quite resilient. You may also be very adaptable and very comfortable with change. So there are immense, this is not an exhaustive list, but there are immense benefits of having ADHD and being neurodiverse. So always try and consider those if you have this diagnosis as well, because there will be a lot of strengths. In terms of mental health conditions, so ADHD isn't a mental health condition in itself, but it can coexist with other conditions and contribute to other mental health conditions as well, particularly if undiagnosed for a very long time. So some of the mental health conditions we see, depression, anxiety, those two are particularly common. So you might experience generalized anxiety, social anxiety, obsessive compulsive disorder, OCD. Personality disorders also co-occur with ADHD, so that's particularly EUPD or emotionally unstable personality disorder. Also eating disorders, bipolar disorder, and then issues with substance misuse. So there's some of the diagnoses you might see. And then at the bottom there, I've also got, you've got sleep issues are very common with ADHD, emotional dysregulation, which is essentially difficulty managing and regulating and controlling emotion. You might experience anger and mood swings, have little sense of danger and take risks. As we talked about in the last few slides, there's a lot of risk-taking behaviours associated with ADHD. So in terms of the causes, we know that ADHD is genetic. So several genes have been identified that appear to be linked to the development of ADHD. It's estimated if you have children and you do have ADHD, then there's about an 85% chance that they will inherit ADHD as well. Prenatal development is a cause that we know of as well. So any insults before or during birth are associated with the development of this condition. So maternal stress and anxiety during pregnancy can have an impact, as can alcohol, smoking and drug use during pregnancy, any exposure to toxins, oxygen deprivation, or any other traumatic birth experience can be linked to the development of this condition as well. The environment is not a direct cause of ADHD, but we know that deprivation early in life and traumatic experiences are associated with some of the symptoms. So ultimately, trauma alters the way in which the brain is structured, and that can be linked to the development of some symptoms like ADHD or mirror ADHD. And the effects of trauma can look very similar. So examples of that might be an inability to focus, and as we talked about, emotional dysregulation, so experiencing ups and downs in mood, being unable to control impulses and emotions. Ultimately, we know very, very little about the causes of ADHD. The research is very, very limited, but it's improving all the time. Ultimately, the more that we know about the causes, the more we can do to treat it. So thinking a bit about the ADHD brain. So the main takeaway really from this, because it's incredibly complex, the neurobiology of ADHD, but the main takeaway is that there are differences in activity levels of the brain, the size of particular structures within the brain. So if you see on the right there, research showed us that there are vast differences in the size and the activity levels of the prefrontal cortex. So this is a major part of our brain that sits within the frontal lobes, and that's really highly involved in a lot of our executive function. And then we're talking about the rate of brain development as well. So the frontal lobes help us to pay attention, to concentrate, make decisions, to plan, to learn, behave appropriately, and to exercise self-control. So that's really important in our executive function. In terms of the neurotransmitters, so neurotransmitters are chemicals which pass messages between the nerve cells of our brains. People with ADHD have key differences in connective pathways within the brain. So there are vast differences in the levels of dopamine, which is one neurotransmitter that's very involved in our experience of pleasure, motivation, and reward. And then noradrenaline is another key one. So this increases our alertness, our arousal, and our attention. So there's a deficit of this neurotransmitter as well. It also affects our sleep-wake cycle, our mood, and our memory, all of which are obviously very implicated in ADHD. So neurodiversity. So this is variously defined, but ADHD very much falls under neurodiversity. This refers to lots of different conditions, neurodevelopmental conditions included, but that will be autism, for example, ADHD, dyspraxia, dyscalculia, dyslexia, Tourette syndrome. You may have heard of all of these. These all come under the term neurodiversity. Some of the definitions here are the diversity and variation of human brains and minds. The idea that people experience and interact with the world around them in a lot of different ways, and ultimately there is no right way of thinking, learning, or behaving. It's okay to be neurodiverse. There's nothing wrong with you if you are neurodiverse. Brain differences are completely normal, and they should not be viewed as deficits in any way. And that actually being neurodiverse has immense benefits for society, just like any trait and variation that we need to survive as a species. This is a really essential part of our society and the world that we live in. If you would like to, I appreciate you can't watch this link now, but there is a link to a video on neurodiversity, and this comes from the channel How to ADHD. So if you've never heard of it, definitely check out that channel. It's a brilliant resource. It's got lots of very fun, engaging videos, led by someone who actually has ADHD. There's lots of great information on there about neurodiversity, ADHD, and then strategies as well. So definitely have a look at that. So before we talk about treatment, I just want to address some of the myths and misconceptions about ADHD, because unfortunately, as much as our knowledge is improving all the time, a lot of people still out there believe in a lot of myths and misconceptions about this diagnosis. So hopefully address some of those. So the first is that ADHD isn't real. I can tell you that's absolutely not true. So we know that this is a condition that is recognised all over the world. So if you look at the map there on the right, you've got North, South America, Europe, Australia, the Middle East. This is absolutely everywhere. And the rates between countries differ significantly, but ultimately there are very clear neurobiological origins, and brain scans show us, as we've talked about, there are distinct differences within the brain. Ultimately, medication that people take works to treat the symptoms. So irrespective of whether you think this is real, medication works to relieve symptoms and people get better and their quality of life improves. And ultimately, that's all that matters. ADHD is a childhood disorder. That's another very common myth. So as we know, this is neurodevelopmental, which means that it begins during childhood. But actually symptoms persist in around 3/4 of cases. They will persist into adulthood. So in a minority of cases, some people will not go on to develop symptoms, but it is rarer. And actually, as we get older, the symptoms of ADHD can get considerably worse. So, and that is because a lot of the structure that we have as children that are implemented by parents, teachers, others in our lives, very supportive. There's a lot of structure around in our environment, and we get a lot of support. But ultimately, as adults, when you go on to get independence, there's a lot more demands, a lot more responsibilities, and that can make inattentive ADHD in particular very, very challenging to manage. Suddenly out in the world on your own with a lot of new responsibilities, and that can be really difficult for people. Another very common myth is that ADHD is a result of poor parenting and a lack of discipline. It might look that way if you're dealing with a child who's very, very hyperactive, can't sit still, is maybe causing a bit of havoc. This absolutely isn't a result of poor parenting. It's got nothing to do with parents or carers or anyone who cares for the child. This is a neurological condition, and that can lead to symptoms of challenging behaviour. Ultimately, parents, carers, teachers, others in the child's life can help by supporting the person to understand ADHD more and provide those really early interventions and environmental modifications, which we will talk about in more detail in other seminars. But this is why psychoeducation is so important, not just for people with ADHD, but carers, parents, anyone who knows someone with ADHD. This really needs to be understood more. The other myth is that ADHD is more common in males. So historically, this is always thought to have been the case. But we know actually girls and women have ADHD too, and actually they have it to exactly the same extent as far as we know. So the rates are pretty much the same between males and females, but they do go undiagnosed, girls and women, for a very long time, quite often, because it can present very differently in girls and women. So it's often very subtle, and women are more likely to be diagnosed with inattentive ADHD, and the symptoms are a lot more difficult to pick up. So difficulties with, as we said, organisation, time management, etc. Whereas boys are more likely to experience elements of hyperactivity and impulsivity and a lot of externalized behaviours. And so it comes out, it's a lot more evident, a lot more obvious to people that something's up, and they are more likely to then seek support and get a diagnosis. So girls and women are hugely underdiagnosed at present, but research is improving all the time and practice with it. So we're trying to address the imbalance between the sexes there. So the final myth is that ADHD is just being lazy, unintelligent, lacking willpower. A lot of people still believe this and don't understand what it means to have this condition. But as I've mentioned, people with ADHD are often very highly intelligent, very driven. They want to do really well in life. They want to succeed. They want to be like any other person. But it is an executive function disorder, which means that there is an inability to act and behave as is desired, as is intended. So using goal-directed behavior to achieve means, and that is as a result of these hardwired neurological differences within the brain. So it's what makes this disorder in particular so frustrating, because it is not about what you know, it's not about what you want to do, but it's about it's having a difficulty executing particular actions, particular behaviours. It's been described before as a condition of performance rather than one of knowledge. It's what makes this so frustrating for people to experience, is that you know what you need to do and you struggle to implement it. So it can be very difficult, but that is a very common myth that needs to be addressed. So finally, we're talking about treatment. So thinking first about psychological support. So there are a lot of people with ADHD who don't want to be medicated, and that's fine. There are some for whom medication won't be suitable for treatment. So in cases like this, the psychological support can make a big difference. And this is very much about helping people to understand ADHD more, about how to cope with their individual challenges. So certainly at our clinic within Berkshire Neuropsychology, we would provide clients with, or offer clients the opportunity to engage in psychoeducation. So that might be in the form of a one-to-one strategy session. It might be a post-diagnostic support group as well that we run, which is very much about psychoeducation, but also it provides an opportunity for people to come together and share their experiences of ADHD. And expand their networks, which is really important to feel inclusive and to reduce the impact, particularly the social impact of having this diagnosis. We'll talk about, or we'll try to teach, the development of coping strategies and personalize that to your particular experience of ADHD. Will be different for everybody. Like I've mentioned, there'll be psychosocial support in the form of groups, and then providing information about environmental modification. So how you can make changes to your day-to-day life, your environment, to make this a lot more manageable. And finally, medication. So a key thing to realise with ADHD is that medication is only indicated when the impact is severe and when the behavioural modifications and interventions haven't been effective. But as is the case with a lot of things, medication and therapy is often the best way to treat this condition. So combined therapies. Medication ultimately isn't a cure. This isn't a curable condition. It is a condition you will have for life. But medication can really help people manage day-to-day functioning. It can help people feel calmer. It can help them focus and concentrate a lot more easily. Help with impulse issues, so being much less impulsive. It helps people to essentially learn and practice new skills. And there are currently 4 medications that we prescribe in this country. So they are methylphenidate, which you may have heard of. These are examples of that are like Ritalin. It's a stimulant medication that works by increasing dopamine within the brain. So if you think back to the neurotransmitters we talked about before, there is lessened, it's a very basic theory, but lessened levels of dopamine within the brain. So medication works to increase the levels of that neurotransmitter. You've got dexamphetamine and lisdexamphetamine, both stimulant medications, and they both work in a similar way by increasing the level of dopamine within the brain. And then finally, atomoxetine, which is an SNRI, or a serotonin and noradrenaline reuptake inhibitor. So this is a non-stimulant medication, and quite often prescribed for people for whom stimulants isn't an appropriate treatment, but that works by increasing noradrenaline levels within the brain. So feel free to pause the video if you'd like some further resources, but here is a list of, there's books, there's articles, there are videos, including the channel I talked about earlier, How to ADHD, some really great resources if you want to go away and have a read, have a watch of some of these. Absolutely do, they're really good resources. And thank you so much for watching. If you have any questions at all for our service, or you want to provide us with any feedback or ask any questions in relation to the content of this seminar, there's any way we can support you, then please call the clinic. So the number is here, it's 0118 929 6400, and we'd be more than happy to address your queries. Thank you so much everyone for watching. I hope you really enjoyed it and I hope you found it helpful. Thank you very much.